So today we're doing a behind the paper podcast talking about navigating hantavirus risk in transplantation and implications for clinical practice. And I'm joined by two of the authors of this perspective that's been published in Transplantation, Dr. Robert Wolfe at Duke University and Dr. Camille Kotton from Harvard. Thank you both for joining me today.
Thanks for having us.
And thanks for having us.
Yeah, so this is interesting. I don't know a lot about this, but in your paper, you cover what makes Andes virus a unique and distinct type of hantavirus, why diagnoses can be difficult in immunocompromised patients, so our transplant population, and what limited transplant case reports show, and most importantly, how this affects donor evaluation and travel counseling, which is your expertise. So, I would like to start by understanding kind of why hantavirus is worth discussing now and why you decided to write this paper.
Yeah, thanks, Macy. I think whenever there are emerging infections that are in the news, it's always a good time to reflect on the place of the transplant recipient and how these potential outbreaks could impact them. And so, we're seeing a lot of these in the news. Ebola is the newer one, even cyclospora we've seen as well. And whenever I'm seeing these, I'm thinking, what implications are these going to have on my practice? And so uh, with my infectious disease background, I'm really interested in a few key questions for these. So, what's the transmission route? And so that's an important thing. Is this something that is vector borne, passed by mosquitoes? If so, that's probably going to be something that's pretty geographically limited. Is it respiratory? Like COVID, we saw that was a big deal and really important because that transmission can quickly spread around the world. Or what's the other way that it could be passed? Yeah, past that, then talking about the infection in particular, how severe can it be? And so, is it one that people get mild symptoms? If so, what implications would that have in an immunosuppressed patient instead of someone with an that's immunocompetent? And then, what symptoms does it show up with? Are these symptoms that could be confused with other opportunistic infections or potentially with rejection? Is this something that could be confused with rejection, where you're having to think about potentially increasing immunosuppression if you're concerned about rejection? And so, what does that clinical syndrome look like as well? Past that, if you're worried someone has it, how are you going to make the diagnosis? In immunocompromised patients, I'm always pretty concerned about anything that relies on serologic diagnosis. I, really prefer things that can be diagnosed based off of molecular testing or cultures because I always worry about the immune response, which we're counting on when we use serologic diagnoses for different infections in someone that has that kind of tamped down immune response because of their underlying condition or medications that they're on. And then past that, is this a treatable infection or not? Is this something that typically we just let ride its course, or are there options for treatment? And so that's the context in which I think about infections when I hear about emerging infections, especially among transplant recipients. So, kind of going through that context with hantavirus in particular, I think is important. So, these hantaviruses, there's a bunch of different hantaviruses around the world, and most of these are kind of rodent-borne viruses and are pretty kind of geographically limited. And so, you have to be in pretty close contact with rodents or their droppings in order to get these infections. Um, the Andes virus in particular is one of these many hantaviruses, but is the only one to date that has had documented spread via respiratory droplets from human to human. And so that's why this was making the news, was that risk for potential outbreaks from that standpoint because of that respiratory spread, and why it kind of passed through this cruise ship as well was the thought at the time.
Interesting.
Yeah.
Interesting. So most people shouldn't be worried about catching one of these viruses unless you're in close contact with a rodent and their droppings, correct?
Correct. I'd say for the most part, for hantaviruses, they're
Yeah.
pretty limited to that close contact with the rodents in particular. So, um, but then Andes was where the Andes virus in particular was where there was a little bit of a unique aspect to this hantavirus in particular that led to the concern.
So what makes that one different?
Yeah, I honestly don't know the kind of the pathophysiology of why this one can be spread via
Mhm.
respiratory droplets, but just for some reason it seems like it can be.
Hmm.
Typically that's very close contacts, so either household contacts or close sexual contacts as well, and so it doesn't seem like it's something that's as easily spread as something like COVID. And so I think the response from the infectious disease community in general, when this was going on, was that this was unlikely to cause like a pandemic like COVID did. Camille, do you have any
Yeah,
other thoughts?
this kind of goes into the general category of when we are doing pre-transplant counseling and post-transplant counseling. We do recommend that people stay away from animals other than sort of their pet dogs and, pet cats, that type of thing, but that we recommend that they stay out of areas where there or contact with rodents or reptiles, snakes, barnyard animals, wild animals, etc. And I get the occasional phone call of, this patient was down in a basement or a shed and cleaning things out, and there was a lot of rodent exposure, and now they have a fever. And that really concerns us a lot because transplant patients are more vulnerable to infection. So we wanted to bring this article up to sort of to write this article just to highlight so that people knew about this topic, and then because there was a lot in the press, and so people have a lot of questions, just to sort of give a general context. Robert's absolutely right that rarely is there transmission of hantavirus, but there has been more discussion in the news, so we wanted people just to be educated and to understand their overall risk. And then we included a figure of not just hantavirus, but other diseases that we get from animals, which are called zoonotic illnesses, and just caution that with exposure to certain animals, they are at higher risk for somewhat unusual infections.
Yeah, this is a great figure. I think we'll make sure this figure is available with this podcast and in the with the transcript, because I think it's a good education, especially when you're seeing news stories and that gets people scared about something. It's so great to have you guys as experts providing accurate education to patients and the public about this topic. So thank you both for doing that. Another question that I have for you is how symptoms of this, like how symptoms may be non-specific or atypical in these immunocompromised patients. Is there what type of symptoms are you looking for, or what types of symptoms are reported to you?
Yeah, so this gets down to, hantaviruses in general. There's a difference between what's seen in the Americas versus what's seen in kind of Europe and Asia. So there's two distinct syndromes that they can cause. The ones in the Americas is kind of a cardiopulmonary syndrome, so kind of more respiratory symptoms that you can see with this. And then in Europe and Asia, it's more of a kind of a renal syndrome. And so the cases that we found in transplant patients, these were all in patients that were either in China or in Central Europe. And so the first one of these cases was actually in someone that they were worried could he be having acute rejection of his kidney transplant because he was showing up with kind of a acute kidney injury and issues with his kidney function. Um, and then the two cases in China had more kind of nondescript or non-specific symptoms, but some GI illness associated with it, both of which ended up being fatal infections for these individuals. But I'd say up front, it can be a pretty undifferentiated febrile infection. So just fevers without any one symptom that would necessarily clue you into this or not.
Thank you. I think you did mention in your introduction about some limitations on testing. especially kind of different types of tests. Could you talk a little bit more about that, especially focusing in on false negative antibody results?
Yeah, so like I was saying, I think it's useful when you can have a molecular diagnosis for something like this, when you have a negative serologic response. You don't know is that negative because the participant may not have had, or the patient may have had an immune response in general that's suppressed, or is it just that they don't have the infection? So kind of that false negative testing is something I worry about with serologies, in particular in immunocompromised host. And so PCR testing is one way that test that hantaviruses can be diagnosed. But to get that, you really have to know what's that genomic makeup, or what is the genome of the infection that you're looking for, and have that predefined PCR primer set that's made. So you kind of have to know that, make your test based off of what's known, and then test for that in particular. And the two cases in China that we reported on, or that we reviewed for this, both of them used kind of a newer diagnostic method, which is next generation sequencing. So then just kind of sequencing everything within the sample, and then trying to see what here matches human versus what here isn't human, and then what potentially could that match to as well. There's a lot of potential downsides to next generation sequencing testing, uh, and there is a chance for false positives with that as well. But when the syndrome fits and you have that testing that shows an emerging infection like that, like this, it's at least something to chase after, I think.
So my notes say MNGS. So that's
Yeah,
exactly what you're talking about.
right. So this is
Fantastic.
metagenomic next generation sequencing.
Camille, do people know about that testing in transplant clinicians, infectious disease doctors, or is everyone up to date on that?
Yeah, we do. We do. It's interesting testing, and actually, it is good with zoonotic illnesses or some of these more rare things that might otherwise be hard to diagnose. That being said, it's actually quite expensive, and not necessarily readily available everywhere. And there can be issues around diagnostic capacity, false positives and false negatives and whatnot. So, this is not a test that's being routinely sent. This is not like blood cultures. It's actually often several $1,000s. So we're being appropriately cautious. I'd just like to take a step back. And one of the classic things that we are taught, which I think is still true, is take a good history and talk to the patient and hear where they've been. Robert's points are really well taken about what we call old world viruses versus the new world infections. So new world is sort of the Americas, and as he mentioned, Asia and Europe have different types of viruses, and I think that's an important distinction. So sometimes I go and I see patients and they are saying, oh, it's in the chart. It's in the chart. I told them everything. We infectious disease specialists have very specific questions. Our tool is really our questioning. That's most of what we do. But definitely, if I were to hear, as Robert nicely highlighted, hear about somebody who's traveled to specific locations or who has specific contacts, that's where we would consider sending this testing in the right clinical setting. I know that he mentioned that there was a sort of a confounding case in Europe where it looked almost like kidney rejection, but that does not mean that most kidney rejections relate at all to hantavirus. But in the right clinical setting, we can think about doing additional testing. And that's where it's so great to partner with transplant recipients and family members who can give us the additional information that sort of leads us down the appropriate diagnostic track.
That makes a lot of sense. You need a holistic approach to understanding the history here.
Mhm.
And I would say, these cases highlight a case scenario where it was helpful, but I'd say from clinical practice, you see a lot more of this metagenomic next generation sequencing that probably is leading you down the wrong path than the right. But, kind of the right path is what gets published. And so you don't see the 10 times it's negative, or the 15 times that there's something detected that doesn't really fit the clinical scenario or the issue at hand.
And Robert, with this hantavirus information, and we've recently had more Ebola virus, and then, well, there's the cyclospora, information. How does this change how you approach counseling, transplant, and other immunocompromised patients when you see them in pre-travel consultation?
Yeah, so there's, almost always a topic of the month that comes up, but really trying to put it into context of I need to make sure I'm staying up to date with what are these epidemics because sometimes patients are asking a lot of really good questions about them, so I need to make sure that I know those, but also just kind of trying to find themes and knowing, animal contact is a big thing that we see here. So spending time talking about just animal contact in general, cruise ships or something else. And so, these would be topics that, regardless of what's the infection of the month or what's the emerging infection that we're talking about right now, I think important aspects to cover with people that are coming into travel clinics.
Very interesting. So you did mention a little bit about these cases, but I'd like to know if you can dive in a little further. I know in your paper there's one kidney transplant case that was initially mistaken for rejection, and then there was another stem cell transplant case with a delayed diagnosis. Would either of you be able to talk about either of those cases a little bit more?
Yeah, I think all of these are just highlighting the difficulty with this diagnosis, and like Camille had said, when you see someone with kidney rejection, this really isn't going to be something that you think about because you really shouldn't be thinking about this. You really have to put it into the context of getting that good history, and so I'd say that's probably the main message that comes out of these is just putting the patient into their clinical context and trying to gather that information from the family members as well. Um,
There are a lot of different infections that can affect the kidney, and so it wouldn't just be this type of virus. There are various other viruses that we've seen over the years and have been reported. So it's not really necessarily kidney specific for this, or that it's these viruses that relate to this type of kidney impact. We just always need to have our thinking caps on, and if things aren't progressing clinically as we might expect, we do need to think about additional diagnoses. Robert, do you think that does this type of situation mean, this was all on this cruise ship? Does this mean that the transplant patients shouldn't travel? Like what's our advice to transplant patients? You're shaking your head no already.
Right. Yeah. So I think it's really important for people to travel. That's obviously my bias as someone that loves traveling. And, one of the things about getting a transplant is that people that may have had to be on dialysis for a long time now have a little bit more freedom to actually do stuff. And I think, it's important to mitigate risks when you can, but I don't think that people can really just live in fear of potential opportunistic infections. And so I've had a lot of people, including patients with history of transplantation, that have written to me after their trips, telling me how much they enjoyed it, and how great their trips were. So I definitely think it's kind of a part of life that I'm glad these people are able to do again, really.
Yeah, I agree with you. I've done a lot of travel medicine for pre-travel counseling for transplant recipients. And, overall, I've had very good success. Actually, most transplant recipients understand that they have a higher risk of infection, and in my experience, they tend to make better choices and overall have better outcomes than the non-transplant patients who seem to be eating more street food, living life on the edge a little more. So we overall have I think between the two of us, have a really good track record. And then we published data on this from earlier this year in Transplantation, the largest series of transplant patients traveling. And yeah, overall, really good outcomes. So by no means should these hantavirus on the cruise ship situation decrease people's desire to travel. It should actually increase their knowledge that they should come for pre-transplant counseling and how can they avoid infections.
Amazing. Is there anything you think that transplant clinicians need to know in general that they may not already know or don't have their eye on?
Yeah, so I think one important thing is just knowing what resources are available. So, infectious disease doctors in general are going to be trying to stay up to date with the most recent, epi and outbreaks that are happening around the world. And so, especially travel clinicians or people that do travel medicine. And so, trying to partner with those groups, I think would be helpful because I do think it's probably exhausting to try to keep up with this on top of everything that's going on in the transplant literature as well. So I think partnerships are important.
Absolutely. Yeah, find your travel partner, travel medicine partner group and know that, to send patients there. And yeah, we've had an amazing safety record over the years. And then patients go on wonderful, wonderful, meaningful trips. Many people go to visit friends and relatives, which is key. As Robert mentioned, some people have been on dialysis for a long time and haven't been able to travel. So life was meant to be lived, and we really want people to have, happy, healthy, full lives. But know to refer people to travel clinic. Robert, I don't know what your thoughts are. I've kind of said they probably don't need to see me if they're going to Europe, anywhere in North America, Australia, and brief trips to the Caribbean. And beyond that, anywhere more exotic, I actually do think they'd benefit by a travel medicine visit.
I agree. Yeah.
And then they're great resources on the CDC website about cruise ship travel. So if a busy transplant clinician hears a patient's going on a cruise and they think, well, it's probably okay, but they could say, you could read the CDC cruise ship website because there's a lot of tips there. And there actually are tips for any travel destination on the CDC website.
And part of
Fantastic.
that, so that's the yellow book that the CDC has, and it's kind of free to the public. And Camille co-authored the immunosuppressed chapter in that as well. So it's a really great chapter.
Oh, fantastic. Maybe we should find that and link that to this episode as well.
Oh yeah, great. Yeah. Yeah.
Awesome. Always hoping for good resources for people because I do think people come across our episodes that aren't in transplantation. Maybe just they're searching podcasts and find something. So the more information, the better. Is there anything else you guys think the public or our patients or our clinicians should know that you haven't already shared with us today?
I
Cool.
think knowledge is power and just understanding the overall, the news drives a lot of this concern. I got a lot of messaging about cyclospora, for example, during this outbreak time. But realistically, I'm in Massachusetts. Most of my patients are in the New England area, and the vast majority of disease was in Michigan. So, kind of, it's okay. It's okay. So understanding risk. But there's always concern that our patients are more vulnerable to infection. So how can we think about decreasing risk of infection?
Fantastic. Well, thank you both for joining me today. I really appreciate your time and for your work. The paper Navigating Hantavirus Risk in Transplantation Implications for Clinical Practice is available in the Transplantation Journal online. Thank you so much, both of you.
Yeah, thanks a lot.
Thanks, Macy. You're great. Thanks a lot.